Okay, so welcome in everyone. Welcome. We're so glad to have you here joining us today for our three-part webinar series on living with autoimmunity. My name is Shannon and I'm going to be your host today. I am an integrated wellness coach and a mind-body specialist with Aila Health. And I'll be guiding our conversation. We're going to be hearing real stories from real people today, those who are autoimmune warriors living with various autoimmune conditions. And we have really three amazing folks here with us today, Jenna Green, and Jake Broughton, and Kanisha Fletcher, all of whom will be sharing their incredible and inspiring stories of their personal health journey through autoimmune disease. So without further delay, I'll go ahead and introduce our first guest, Jenna Green. And I'm going to go ahead and take down this slide for now, so we can all see each other here on the screen. So Jenna, let me go ahead and spotlight you here.
Fancy.
Okay. There we go. So great. So yeah, welcome, Jenna. So just by way of introduction, Jenna is a multiple sclerosis advocate living outside of Boston with her rescue dog, Dixie. She was diagnosed with MS in early 2016. She is a self-employed social media marketing consultant and course creator. She's currently working on a new course designed for people with illness or disability that can't work a traditional 9 to 5 day and are transitioning to self-employment. She volunteers with the MS Society and is also working on and off social media to help change public perception of invisible illnesses, as well as public policies that prevent disabled and chronically ill people from living their best lives. So welcome, Jenna, and I'll turn it over to you. Maybe if you would just like to, start by giving us a little bit of background on your diagnosis journey and what that has been like.
Thank you so much, Shannon, and thank you all for joining us and tuning in. That was such a nice introduction. I'm so, wow, I feel very fancy. Oh, I appreciate it. And I am going to save some time at the end. I'm going to talk for a few minutes. I'll tell you about my journey. And then if you have any questions, please feel free to ask them of me, either here in the chat or you can always message me on Instagram. I'm mostly active on Instagram for my advocacy and social media work. It's the Jenna Green at Instagram, like THE in front of the Jenna Green, because Jenna Green was taken and now it's a hilarious joke with my friends. So like Shannon said, I was diagnosed about 5 years ago now with multiple sclerosis, which is an autoimmune disease. And I'm not a scientist, I'm a marketing person. So the way I explain how MS works is, well, of course, my cords are all the way over there. So I have no fancy props for you, but imagine like your phone cord or like something, a charging cord, it has the plastic around it. And then if it breaks up at the end and it starts to fray, it can be really dangerous, right? Like things can get on fire and bad stuff happens. I am notorious for not noticing that. MS essentially is attacking the nerve coverings, which is called the myelin sheath, all throughout your body. And so it's essentially fraying that plastic outside covering, and then bad things happen, just like if you plugged in a frayed power cord, so that's essentially how the immune system starts to think that that's what's happening. The immune system starts to attack the myelin sheath. So it's kind of rude. It's not, I don't recommend it. They They don't know why it happens yet, but there are nearly 1 million people in the United States with multiple sclerosis, and it happens to men, women, children, people of all backgrounds, races, everyone, unfortunately, and they don't know why. But we don't have a cure yet either. It is a degenerative neurological disease. So it primarily attacks, you'll see lesions in on brain MRIs and spinal MRIs. But like I said, because it attacks the coverings on your nervous system, it can literally affect you from head to toe. And it's invisible, right? You can't see it like most autoimmune diseases. So when I talk about changing public perception, my goal really is to realize, help other people realize that you don't know what someone's going through. You don't know, whether they're sick, quote unquote. There's no sick look. Whether I'm using my cane today or not, that does not mean I have more or less multiple sclerosis. My disability and my functionality of my body varies from day to day, which is, of course, another frustrating thing with many autoimmune diseases. Um, but I was lucky to actually be diagnosed fairly quickly. And then I worked with my neurologist. Like Shannon said, I live outside of Boston, so I have access to really great hospitals and doctors here. I worked with my neurologist to pick one of the multiple disease modifying therapies that are on the market. Like, it's not a cure, but it's supposed to slow the progression of your disease. And I decided to go for, the one that was statistically the best option, because while everyone with MS is different, they call it a snowflake disease, although I prefer unicorns because, like, I don't really like snow, even though I'm from Boston. I decided that, I was going to go with my neurologist's recommendation and start with the statistically most effective medication on the market. And I had great insurance. My now ex-husband, but has a Cadillac plan from his union health insurance. So I thought this won't be a problem. And then I showed up they called me before my first infusion appointment for this disease modifying therapy to help prevent my immune system from continuing to attack my body, right? At 31 years old and relatively in the healthiest I've ever been, right? Like, had lost weight, I was doing yoga, I was like, walking dogs, and had 15 clients for my freelancing business. I was like full on in the hustle culture, which again, don't recommend. But that was at the time. And they called me and they said, well, I don't think you want to come in today because your insurance denied this. And they said that you actually have to start on a statistically less effective older therapy, have it fail you, which means more damage to your immune system, brain damage, spinal damage, increased disability, loss of function, hospital stays, rehab. Like, there are very serious consequences of this happening, of a medication failing you. And then maybe you can move to this statistically more effective medication. And so that is when I decided I was going to tell everybody and their mother about what multiple sclerosis is. And I knew I had a privilege. I knew how to use social media. I knew I had a platform. I had the privilege of support from my family and friends. And I wasn't afraid to speak out about it. So I was like, oh, you people go ahead and bill me. I'm coming anyway. Also, don't recommend that because it's like 20 grand per infusion. So 0 stars. Don't do that. I was young and hopeful and naive. But I did get it appealed, thankfully, with the help of my doctor's office. But I mean, even now, I don't know that I would have the stamina or the cognitive function to go through that again. I mean, that would take a lot more out of me now. And so that's why I started in advocacy work. That's why I started sharing my story. And I literally just started sharing on Facebook and Instagram and talking about it. And now, like Shannon said, I volunteer with the MS Society. That fail first protocol is called step therapy, which again, I didn't know at the time, but we are trying to change that and make it illegal here in Massachusetts. So if you're in Massachusetts or know anyone in Massachusetts, we have, we are currently trying to change that with the MS Society, and quite a few other organizations that are against step therapy, and we're trying to reform that here in Massachusetts. So I've been sharing about that, and there are some easy automated links where you can ask your representatives to support that bill. But anyway, I think I was trying to time myself here, but I get talking, and there we go. So that's basically my method for advocating is just not shutting up. That's kind of advocacy in a nutshell. I didn't know it when I first started doing it. My mom was like, wow, I thought that your ability to never shut up about things was really going to get you in more trouble than it has. Like, whereas, it seems to be working out for you pretty well right now.
And Jenna, I'm wondering too, you highlighted several things here with, with this invisible disability aspect of things, also ways for, advocating for yourself within the healthcare system. Do you have any recommendations for people who are maybe trying to navigate it, the beginning stages of an autoimmune condition and really not quite sure how to tackle, like the healthcare system, like you were saying, is big and intricate and overwhelming. So, do you have anything that you'd like to speak to specifically around
It
that?
absolutely is very overwhelming, and I still find it overwhelming. So if you're feeling that way, please know that you are not alone. But yes, I would say my best advice is always take notes and like journal your symptoms and things for your doctors if you're having trouble getting a diagnosis. I like to journal in general because I find it helpful, but I do tend to note different things. Like I have, in addition to multiple sclerosis, I have a specific type of spasm muscle movement disorder called dystonia, which is also its own disease, but mine is because of multiple sclerosis. So my feet clamp like this, and I started having more spasms in my right shoulder here, and of course, when I'm thinking about it, it hurts more. But
Mm,
so I've started documenting in photographs how much bigger my right shoulder is than my left for my doctors, so we can see if we want to talk about possibly doing the injections into my shoulder area as well. I don't think we're there yet, thankfully, but documenting your symptoms in that way. And then when you're at your doctor's appointment, I personally find it easiest to record them instead of taking notes because, and it is great if you can have someone go with you. But of course, in like this COVID world, some of the benefit has been telehealth and having telehealth appointments, and then it is easier to, if you live with someone, you can have someone with you. But if you're in person and you don't have someone with you, I always ask the doctor if I can record it. Like I just use Otter, it's Otter, it's a free dictation app, but there are some other really great ones that I've used in the past as well. But just record that because it's so impossible to remember everything, even if you are physically and mentally feeling really well. It's a lot of information in a short amount of time. So I come prepared with, the things that I've written down and any specific questions I want to talk to my doctor about, whether it's in person or not. And then I ask them if it's okay, of course, and I record that session. And then that helps me personally. Also, I don't know about every autoimmune disease, obviously, but for the MS Society, they have a great navigator program that helps people with MS or, that may be receiving an MS diagnosis and helps them find different resources and not just doctors, but also things like if you need bars installed in your bathtub, or which
mm,
I did. And PS, like that was the best thing ever because I didn't think I was going to need them, but now I have them and they're great. But they help you, plan with your finances, and they have all kinds of information. They can help you if you're having trouble paying rent. They can help you. It's just an amazing program. So definitely take advantage of that. Someone had a question, I think, about the walls protocol, I want to say. Yes,
yeah. Yep. And we
Elena.
have just about 2 minutes left. So yeah, maybe we can address Elena's question here. Thanks.
Oh, and I thank you, Ariel. That makes me happy that it resonates with you. I mean, I'm sorry it resonates with you because it sucks, right? But um, I will say that while nothing about having an autoimmune disease is really awesome, the one really awesome and truly the best part of it is the community that I found. And I think that had I not gotten upset about this health insurance step therapy protocol, um, I would have never really started sharing this, and I would have never found this community, and I would have never met some of the most amazing people that I know. So um, I'm super grateful for that. Hearing from the fellow people that even if it's not the same, but they get it, it really helps. Elena, I have tried the Walls protocol. I've actually tried quite a few different protocols. For me, it did not make a difference, although I know that nutrition and supplements and vitamin levels and things like that do make an impact for many people. I do a lot of holistic therapies. I actually ended up getting a test that test my levels of like inflammation to different foods. So now I specifically avoid those foods, and it's not Wall's protocol per se, but for me, I think it's helped. Of course, it's hard to measure because the inflammation, again, is not something that you can see. And I have had 5 relapses in the past 5 years, despite doing the very best I can to keep my stress level low. I meditate. I do a lot of stretching and yoga and walking and online physical therapy and things. So I do think it all can help. I really do. It's harder to measure, but that specific protocol for me did not help all that. Did not help. Didn't see any sort of difference. But you have to figure out what works for you. And I do take a variety of like supplements and things, and of course my doctor knows all about it. And I go to acupuncture. I have a great acupressure mat that I lie on every day. I have a massage therapist. I use essential oils. I take vitamins and get my levels tested every 6 months. So I think more so than following something specific, it's all about listening to your body, which is hard even when you're healthy.
Mm,
But listening to your body and remembering that you are the expert in how you feel in your own body. So whether your doctors are taking you seriously or not, remember that you can fire them. You can find another one. You are the expert in your own body, and they are the experts in the medical jargon, but you know yourself better than anyone else. And when you feel confident in that, I do find that you get better care and you are more empowered. And that
mm.
empowerment it makes a big difference when you live with an unpredictable autoimmune disease. So I
I
hope that
love,
helps.
I love that so much. Thank you, Jenna, so very much for sharing part of your story with us, and just offering hope with regards to dropping into that intuitive place of being your own advocate, and feeling confident in navigating your own health, and with yourself and your self-care practices, what you're doing on your own, but then also within the medical system as well. And we can keep the chat going, if there are some other questions that come up for Jenna. But we'll just transition right along here, and just also in the interest of providing resources here, which we can do that in the chat as well. But at Isla Health, we have a symptom tracker. We have an app that is built, exactly for like Jenna, what you're saying, tracking symptoms, and just collecting your health data, and so that you can bring it to your doctor and say, here, this is what's been going on with me. This is, here's my medical records. Here are my lab results. All of it. So thank you so much, Jenna. And
Thank you. And yes, I actually I just started tracking it in the app. So I should have said use the app. I don't know, but hey, Shannon's on top of things. I need more coffee.
Thanks, Jenna. Well, we're going to move right along to our next advocate, and so Jake, I'm going to bring you into the spotlight here. So, would like to introduce Jake. He has been coping with autoimmune disease since 2013. And this is when he first began his journey through 28 different doctors and 4 years of searching for answers. He received diagnoses such as rheumatoid arthritis, fibromyalgia, Raynaud's, PANS, Lyme disease, and others as well. So, with no consensus between physicians, Jake decided to take his health into his own hands. And he spent years of digging for root causes that led to a life of disability and suffering. And by eventually working with functional medicine doctors, Jake was able to address not only infections and toxins, but also nutrition, lifestyle changes, and his mental health. So through his health battle, though his health battle continues, Jake is passionate about pursuing a career in health and wellness. And he also serves on the board of directors of the Lyme Education Awareness Foundation and is co-admin of the Lyme Alive Information and Support Group and is a manager and multi-instrumentalist in his band Definition of One. So welcome, Jake.
What an intro. Thank you so much. I appreciate it, Shannon and Aila Health for having me on today, and then having this webinar to raise more awareness for autoimmune disease and just bring our stories together so we can all kind of relate to one another and see what works for one. Sometimes what works for one doesn't for another, but we can at least know what's out there and know what options there are. But I think there's a perfect segue from Jenna to my story in terms of what she was saying about listening to your body and advocating for yourself, and not taking certain opinions or answers from doctors that you might not agree with, and going and get second, third opinions. As Shannon said, I saw 28 doctors, and that was all in the fields of rheumatology, urology, immunology, orthopedics, a spine and pain specialist. And I just ran the gamut through these doctors. And so for the first year, I had a doctor mention that he looked at my hands and he noticed that the blood wasn't, coming back into the hands properly. And he mentioned I had some sort of connective tissue disease. Wasn't sure what, didn't order any labs, but said maybe it's lupus. So he went straight to that. And I was like, all right, well, I looked into that. That sounded pretty scary. And then I went to go naturally see a rheumatologist, since that's who deals with that. And he comes out with, it's not lupus, you have one marker that shows you have rheumatoid arthritis. And I was on par with that, because the main symptom I was having was my hands were really achy and sore on both sides. And I started developing spine pain, and that brought in the spine and pain specialist. And then after a while, I started taking those types of meds, like Jenna mentioned, the DMARDs, which are disease modifying anti-rheumatic drugs. And I started on those and another drug that's actually a kind of like a chemo light drug called methotrexate. And after 3 months of a course of that, I was monumentally worse. I did not get better whatsoever. So I stopped those meds, and I got a second opinion at Georgetown in DC here. She says it's not true rheumatoid arthritis. She thinks I have fibromyalgia. Meanwhile, more and more symptoms are coming on after doing those meds. I'm starting to have neurological issues. I'm starting to have arthritis in other areas of my body. I was already having light sensitivity, headaches, brain fog, memory lapses, stuttering coming and going, all sorts of symptoms. Literally, it became like 40 symptoms that would just rotate on any given day, and you really never knew what to expect. So then I waited 6 months for an appointment at Johns Hopkins in Baltimore, and she disregarded all the neurological stuff, tested me for the rheumatoid things, and all I had was that one marker for rheumatoid arthritis. So she went back to that, and I was really hesitant to go back on those types of medications. And I did the same thing and did my research, found which one was the oldest, the most tried and true anti-rheumatic drug. And even trying that one, it was the lightest one called Areva. And it after 3 months, I literally could not retain any information. It was hard to read books. I had to stop going to school at the Art Institute for audio production. I was like 3 courses shy from graduating. Now the college no longer exists. So I had to drop out of school. I had to stop working 3 years ago. And once I got to the point where I tried this new drug for 2 or 3 months, I doubled down even worse. All the symptoms just grew more and more intense. And all the while, I was in an apartment complex where I guess another unit had a water damage and black mold came about and got into the walls and into the ventilations of our unit. So all the while I'm taking these immunosuppressive drugs, black mold and aspergillus and all this stuff is starting to come into my system. Now, in the midst of all of that all started in 2013, and I'll flash forward to 2016, where one doctor, the spine and pain specialist, tested me for Lyme disease. And on the test, the lab said I was positive, but it's a tricky test where you have to have X amount of bands positive to say you have definitive CDC positive Lyme disease. It's not a yes or no, positive or negative test. But the test I paid for out of pocket said I was positive, but it wasn't CDC positive. So I begged these doctors to try and treat me for Lyme, just give me antibiotics, let's try it out. No one would treat me. So at that point, I gave up. I said, I'm done with these doctors. I'm gonna hit the books and I'll figure out how to naturally treat myself. So I did that for a while, and I was making some progress. Some days were better than others, but I basically confirmed that it was Lyme because there's what's known as a Herx reaction, where you take the antibiotic or you take a certain herb and your symptoms flare out. It's not a side effect like nausea or headaches. It's literally the toxins of the bacteria breaking up in your body and creating more symptoms. So I leaned on this book that I think is very important. I wanted to share today that really changed my life to go down the functional medicine path, was called How Can I Get Better by Dr. Horowitz. And he breaks your health up into 16 points of health. And he uses the analogy, like if you have 16 nails in your foot and you pull 1 or 2 out, you still have 13 or 14 nails and you haven't addressed the whole problem. So it could be one chapter is sleep, another chapter is psychiatric stuff, another chapter on nutrition, another chapter on lifestyle, and obviously in my position, a bunch of these microbes and pathogens. So when Lyme came about, I don't know when I was bit by a tick. I don't know when that occurred. It's my conclusion at this point that people are probably exposed multiple times throughout their life. I have come across countless people, and especially in the office, in the IV room, and in chat rooms and whatnot. The most common misdiagnosis is MS and rheumatoid arthritis. When Lyme first popped up, it was thought to be rheumatoid arthritis. In the 80s, when MS popped up, they found that it was the Lyme bacteria that caused it. It was even in the newspapers, but that's all not available anymore. We have commercialized medicine now. So they're literally advertising us these autoimmune meds, and they work for some because they turn off specific autoimmune markers and it'll shut down some symptoms, but it's not treating or addressing these underlying issues that could be not just Lyme, it could be, and right now, for instance, COVID. COVID's a prime example and shines a huge spotlight on the fact that infection can drive the inflammation that drives the autoimmunity. So, in my case, at this point, I had to get a Mediport that cancer patients get, and I did antibiotics and antifungals for the mold for on and off for 2.5 years. I finally got it taken out recently, but I did catch COVID earlier, in the pandemic when it first started. It was the first time I was safe to say I was lucky that I was in with these Lyme doctors and functional medicine doctors because they know how to treat these very persistent, insidious pathogens. And for me, with all my underlying conditions, I didn't even go through most of them, but there's some very serious stuff going on with bone infection due to my sinuses and the mold that attacked me, and just the Lyme itself. It opened up other infections that are known as Bartonella and Babesia. Those are common co-infections that a tick can pass along. And the damage we're seeing with COVID is the exact same damage we see with Babesia. So, a big misconception is that Lyme is rare. And honestly, it's not. In all definitions, it's a pandemic. It's in 65 countries, and it's in every state in our country. It notoriously was known as a Northeast disease, starting in Old Lyme, Connecticut, and Massachusetts, Maine, but now it's migrated due to birds, animal patterns, and tick patterns. It's now in every single state. What else? Other misconceptions is like when you get a tick bite, a lot of people think you're going to catch the bug, but really these things are the size of a period at the end of a sentence in April and May when they're born, and sometimes they're born infected. So you could never know that a bug landed on you, and the rash only occurs about a third to about 2/3 of the time. So there's a window in there where the only tall tale sign that you've been infected with this infection is the rash, but it doesn't happen all the time. I never saw it. I never saw a bug, but here I am 8 years later, and I'm still not working. I'm still debilitated. But it's led me to this life of advocacy and, getting into trying to prevent others, from going down this road of traveling doctor to doctor and, trying to nudge people in the direction of some of these functional medicine doctors, integrative or naturopathic, because they really look at the body as a whole and they use the best of all worlds of medicine. So, my doctor had a background in rheumatology. And so that's who I went to unravel all of these autoimmune diagnoses. I came across, between me and my ex-girlfriend, we came across 9 different autoimmune diseases. And then now after treatment, all 9 were gone, off paper, off labs. So that's a big misconception when we have 24 million people out there with autoimmune disease. The CDC used to only report 30,000 cases of Lyme a year up until 2015. Now all of a sudden they say it's been 500,000 for the last decade, every single year. And a good third of those patients develop the chronic form. So there's a huge correlation, and I think, another book that highlights it that just came out is called Chronic, the Autoimmune Pandemic and How to Get Better Again. It was supposed to come out last year, but then a real big pandemic happened. So now they pushed it to this year, and it just came out, and it markets to the whole autoimmune community, but it addresses the lifestyle changes, the nutrition, all the things that we can control on our own, but also the things we kind of can't, because as much as we love to be out in nature, we have to respect it too and realize there's things out there that can get us sick. And it's not just the ticks, it's sand flies, it's spider bites, it's mosquitoes, you name it, fleas. They all carry bacteria that our immune systems hold down until the pot boils over. So now in my case, at this point, I'm trying to wrap it up, but in my case, I've been diagnosed with Wegener's disease, which is basically the only autoimmune disease that they admit on their websites that it's infectious based. It's due to bacteria, viruses, fungus, mold, you name it. And Reiter's disease, which is reactive arthritis. So it's not just the large joints, it's the tendons, it's the ligaments, all the little cartilages and everything. So a lot of plantar fasciitis, and then you get the MS-like symptoms too. So I mean, I have all the brain fog, I have horrible neuropathy in my hands and feet, and Wegener's is a pretty vicious, progressive autoimmune disease, and they've deemed it as such because I fit that criteria along the way, where it started off looking like RA, and then I had all these sinus issues, and then now I have lung involvement. COVID didn't help that over the year. And there's been even publications of COVID showing that it pushes people into this realm of autoimmunity of Wegener's disease. And in the 80s, it only gave you about 4 to 6 months to live. Now it's 10 to 12 years. But with the help of functional medicine, I'm trying to stretch that out. I'm not trying to fit in a label of autoimmune disease and try the same drugs that got me sick in the first place. For some people, they work because they might not have all these simmering pathogens going on. For me, I had a lot going on and ended up in a black molded apartment. So everything combined together, it was just, it was
And I
lined up to make it a bad situation.
and I am seeing a comment slash question come up here in the chat from Laura, who says, I've been confused when I've heard about pathogens versus autoimmune because it seems like doctors seem to fail in one camp or seem to fall in one camp or another. But is it a chicken or an egg scenario? So maybe in like our remaining minute, Jake, do you have anything to add to that?
Yeah, what I'll say is you're right. There are, like with Lyme, at least, that it's a test that's very difficult because it's not yes or no. So there's no way to track along your disease course. Okay, did I clear this infection? And now I'm dealing with the autoinflammation and you're in this autoimmune realm. But to me, it seems like there's this threshold where infections were pushing me into autoimmunity. But my ex-girlfriend, she was diagnosed with MS. She had brain lesions. I had spine lesions. She treated the Lyme and underlying infections. The lesions went away. All her symptoms got better. And, unfortunately, it's just this gray area where the Infectious Disease Society, and rheumatology, neurology, they do sit in this camp. They neglect chronic Lyme disease. It's been neglected for 40 years. It's now starting to make some more headway. But in my opinion, I think the infections are the chicken and they're laying eggs and they're creating a lot of autoimmune disease out there. I literally came across 9 different autoimmune diseases through multiple doctors in 4 years. And I don't have time, but in hindsight, this goes all the way back to my childhood. And there's one called PANDAS, which is a pediatric autoimmune psychiatric illness. And looking back, pathogens like strep, pathogens like Coxsackie, which is hand, foot, mouth disease, varicella, some of the herpes families, HSV1, HHV6. These pathogens are things that doctors do not look for. They never really do. So for me, it seems that the culmination of infection does drive the inflammation. Our bodies innately are not meant to start attacking itself. It's meant to thrive. So it may not even be just infection. It's infection plus heavy metals or lead or your diet. 75% of our immune system's tied to our gut. So a lot of autoimmune patients get well just by changing their whole diet. So sorry, it was a long answer, but it's very complex. And the last thing I'll say is I represent the Lyme Alive Foundation. I'll put the links in there. And I think the best thing we can all do is join together, because from what I've seen with different autoimmune diseases, it kind of splits up that 24 million people and all the Lyme community and the COVID community. If we all just came together, since we're all pretty much experiencing similar disease, but varying manifestations, I think we'd make a larger impact in reaching out to our senators and our Congress and whatnot. So yeah.
Well, we'll have to leave it there for now. Thank you so much, Jake, for speaking to this part of your story and your journey and how you're advocating for other autoimmune warriors in this space. And yeah, please feel free to, there you go. Yeah, and share.
That one's purely for the children. We go out directly to the children and try to raise awareness in a non-fear based way before they get sick. So
and
that's
we're stronger together as a community, right? When we can come together and help each other in this space is where change and health and where we can thrive. So thank you so very much for being here and giving light to some of your some of your story.
I appreciate it. Thank you so much.
Thanks. Great. So, well, we're going to move on from here, and I would certainly like to welcome Kenesha Fletcher into the spotlight now. Hi, Kenesha. Good to see you.
Hello, how are you?
Very well. Good to have you here. So Kenesha is many things. She's a mom, a wife, advocate, social media influencer, blogger, chronic illness warrior, holistic healer, life coach, and business owner, just to name a few. She battles with fibromyalgia, Crohn's disease, facet joint arthritis, high gluten sensitivity, and vitamin D and B12 deficiencies. So her Instagram, Fibromyalgia Awareness, is a place of comfort, peace, and understanding for those all over the world who suffer. Kenesha is passionate about encouraging, loving, and embracing other autoimmune warriors in their struggle. So welcome, Kenesha. It's so great to have you here.
Hello. Please forgive me, everybody. I am very blunt, honest, and open. As I stated earlier, I just kind of woke up because I like naps. So my voice is in here as well. So let's see, where do I start? Uh, 2013, I decided I needed to go see what was going on. I had a boatload of issues. From migraines to I was diagnosed with plantar fasciitis. I was diagnosed with a boatload of issues. I mean, I was diagnosed with so many different issues, giving so many different medications, and um, eventually I went to a rheumatologist and I was diagnosed with fibromyalgia, and it was devastating because I was young with children, and I'm like, oh my God, my life is gonna end. I don't know what I'm gonna do. I'm so alone. Nobody believes me. They think I'm lazy. Meanwhile, I'm popping pill after pill, so I'm gaining weight. And my husband, like, he could tell you he thought I was lazy. He just thought because he didn't understand it. And long story short, I went to multiple doctors. For about 10 years, I was on 22 pills a day. Um, Now I am natural, and I've been natural and holistic for going on about 4 years now. Um, and actually, I am very excited because with the Crohn's being an autoimmune, is definitely a big autoimmune disease that affects me. Um, I went into remission in December by going completely natural, doing a worldwide pandemic. So I'm extremely excited. And I worked full time and worked with the public. So because I'm considered an essential employee. So I was super excited, like super excited. So, like I said, long story short, I've been to multiple doctors. I was on 22 pills a day. I am now natural. I put my Crohn's in remission. I'm very excited about that. I'm very passionate about advocating for especially chronic illness warriors. Definitely fibro is a main one because we're so misunderstood. Um, we're not believed. We're looked at as if um, we're faking, we're crazy, it's all in your head. And Jake spoke very well when he spoke on COVID because yesterday was Fibromyalgia Awareness Day internationally, as well as I got a proclamation for the third year in a row in my hometown for it to be Fibromyalgia Awareness Day. But I also relate fibromyalgia symptoms to COVID as well. Almost every single symptom of COVID is a symptom of fibro, and it's crazy. Like the chest pain, the headaches, the fatigue. Um, I mean everything, the breathing. It's crazy because fibro really, really affects your body. Um, so what I actually love doing on my Instagram is advocating for us. I speak a lot of truth. Um, my truth. I give my own personal opinions on life. I hate seeing people down and out because being chronically ill and having an autoimmune disease, you can be so misunderstood. So I thrive to help others feel like they're worth something. And just because we're chronically ill and have autoimmune diseases does not mean we have to stop life. it may be put on halt, or as I tell some of my followers, we are the pilot of our bodies. Let your disease be your passenger. Still go where you would like to go, but you fly the plane. Of course, you're going to have to stop off every now and then, to drop off, you know, your passengers, but we can still thrive and still go on. I'm very passionate about being positive and with our health. Fibromyalgia can really affect your brain. So, with that being said, Jake also spoke on fog, brain fog, and fibro fog is uh, very similar. You could today, if I stutter, please forgive me. I woke up with a little more pain than normal. So with the pain, it can take over your thought perception, and I can go into a state of being forgetful. So just at the drop of a dime, and it's not like I'm doing it on purpose. Their pain receptors just go, hey, you know what? We're taking over, and your body goes, you know what? I can't even remember what I was thinking about. I don't remember what I was talking about. Um, it really affects your fibromyalgia, and I would say autoimmune diseases can really affect you cognitively. It really affects you mentally. I'm really big on mental health as well because when you're chronically ill or have an autoimmune disease, period, it affects how you live your life. Mentally, you think you're okay, but your body doesn't let you feel that way the entire time. So it can play tricks on you and make you think one way when you really should be thinking of all the happy things you have that you can still rely on. You can still think about the, I'm sorry, my phone, please forgive me. You can think about the happy places and the happy things you have. Um, you can think about the fact that even today, I'm here online, guys, with you, but I didn't wake up the best, you know? So um, being chronically ill can definitely change your life. But I would really love you guys to know that you need to work on your mental health. And that's my big thing. I love helping people, and your mental health is a big part of you being chronically ill or having any kind of disease, because if that's not there for you, then or if you don't have that, then it's not going to be um, easy to deal with. We go into states of being depressed. I still battle being depressed and having anxiety. So I love the fact that they're giving away online life, like the life coaching. That's amazing because while you battle, the purpose of life coaching being that I'm a life coach as well, I specialize in wellness and mindset transformation, but um, I would prefer that you, sorry, brain fog. Can you tell like online it does this to you and it's like live and you guys see this, it really happens. Um, so with mental health, like I said, it really can affect how you think. And I really love the fact that they're offering the life coaching because it's something that we all really need. We really need to tap into the fact that someone can help guide us to still be the same person that we are, but help guide us and be in that particular moment to not also think back. Don't go backwards. So with my health, I can speak on so much. I get it. I've been alone. I've been mistreated in the medical industry to the point where I could sit here and cry and tell you the things that I've been through. It's ridiculous where I was misdiagnosed with fibro so many times. I was giving pain meds that I didn't need. I was giving medication without even seeing a doctor. And at what point in time do I tell myself, look, Nisha, you need to advocate for yourself. You need to do something for yourself because clearly these 20, um, clearly, being going to the doctor, they don't care. They're just going to pop me with a bunch of pills. And I'm not saying that anyone shouldn't take them. My journey is different than some others, but my body does not like pharmaceutical medication. I literally am a whole nother person. I don't even care if it's Tylenol. I would love for you guys to take advantage of the free life coaching that they're offering because being chronically ill, I will stress this, this is something that I love, can definitely mess with your mind mentally. And I just love for you guys to just be aware of your life, be aware of, start paying attention to the little things in your body, things that I had to start doing now that I'm natural. The little leg issue you may have, or we can go to headaches. A lot of us deal with headaches. So it could be a chronically ill issue where you're having chronic migraines, as I do. So dealing with chronic migraines, I realized one day, okay, the meds weren't completely stopped. Um, Literally, it was like, okay, something has to give. There's nothing wrong in my CT scans. I'm perfectly fine here. So what else do I do? And being that I have an awesome team now, I was sent to a chiropractor who specializes in fibro. Fibro stems from your central nervous system. My nerves are they're heightened. They are overactive. I'm sorry, they're overactive, which is definitely heightened. So I process pain differently. So clothes hurt, hugs hurt. Granted, I love giving hugs, but they hurt. You know, doing my hair, sitting here actually, my legs are crossed. So eventually I need to move them, but I can't because then I'm gonna look kind of funny on camera. But um, just little things. So I just would like you guys to know I need you to pay attention to your body, be aware of things. Because once I went to the chiropractor, I realized he specialized in fibro, um, central nervous system. It literally, once he readjusts me, it realigns my spine because that's where your nerves are. So it puts you in places where you have those small nerves or something that can be not in the proper space, that puts you in a proper alignment to help you not have as bad headaches and also helps my fibro. Um, and with the Crohn's, I mean, it's ridiculous of the pain that you can go through having autoimmunity. So drinking water would be painful, especially when you're having a flare. Eating anything that I was supposed to have, um, was painful because my TMI, because I'm this type of F kid. So mine didn't come out this way; it came out the other way. So I'm just very thankful that I am in remission now because I don't deal with not nearly as many issues as I did with Crohn's. I'm diagnosed with severe IBS now because I'm super sensitive, but pay attention to your body. Um, Even if you take meds, pay attention to the fact that how different meds work for you. Pay attention to the part of your body that's bothering you and try to connect it with something you ate or something that you taken, or maybe the small thing like I could stump my toe. So it will cause a whole flare in the right side of my leg. But I totally forgot 2 days ago that I stumped my toe. So it's not necessarily a big issue. It's the fact that my toe, I have fibro, so it resonated up my whole entire
Mm.
leg. I just want you guys to just pay attention to anything, your stomach, your head. It all can be related in some instances with some different illnesses. So pay attention to help yourself, whether it's with medication or without medication. I don't know if I'm talking too much or if I've not said enough, but is that okay?
Kanisha, your story is so inspiring and uplifting and such a message of hope and I'm just wondering too, we can have just maybe another minute here for any questions that are coming up in the chat or otherwise, but I'm curious, you speak to this place that you've come through and in being not believed by medical professionals or by others in your family, who of course are not really seeing what's going on with you. What if you could maybe offer some advice or even just some wisdom from your own experience with that for how you did or how you do cope with that and manage that in your health journey.
Honestly, even like I said, I'm very blunt, honest, and open. So I had to literally buckle down and tell myself flares are very, very, very painful, and that's with any illness. And when you go natural, you really realize negativity dwells, and that does not help your nervous system, which is fibro, which is really bad, which I could get into a flare. Um, it doesn't help your body overall with any illness when you're negative. It changes everything inside of you. So I had to realize I had to be positive. I had to realize that letting go of the negativity of other people actually helped me because whether they believe me or not, um, I'm still in pain. But the fact that I was upset of the fact that they didn't believe me and they didn't trust me or they didn't treat me right, it bothered me and would put me into flares. And I had to start telling myself, I am not going to let the doctor put me into a flare. I'm already in enough pain. I'm not going to let a family member put me in. I'm already in enough. Like I go through pain 24/7, 365. There is no possible way that I need to let other people dictate how I feel. Second of all, I've let them win. and that's negativity, and I'm not going to let negativity dwell inside of me. We all have our good days, but there's no way in the world that I have to tell myself I will not let anyone dictate whether I have a flare or not. My flare will come from the fact that maybe I did something wrong. No, or the fact that I stumped my toe and didn't realize how hard I hit it. Oh, positivity matters. Can you read my shirt? That's
Right?
my profile.
Very
Yes.
relevant.
Yes, that's so me. So I'm all about positivity. So I had to realize I had to change my thought perception. I can't let other people get to me. So if you can at all find it in yourself to believe in yourself is the big thing. Mental health. Believe in yourself. Don't let other people make you feel worse because it doesn't help. It does not help. You're not going to get better by letting other people dictate how you feel. It doesn't help me at all. So please, mentally, please believe in yourself and just let the rest go. You know what your problem is. You know what your issue is. You know what you deal with. Don't let others how you feel. Oh, and I see my Instagram. If you could follow my personal Instagram was Tanisha Lacole, but my other one is Fibromyalgia Awareness, where I speak more of my truth and more of my life. So, yeah.
That's beautiful. What a wonderful way to wrap up our time here today with such an inspiring message of positivity and in self-care and the importance of all of this work that we do within ourselves to manage our health and to take care of ourselves and to listen to the needs of our body and attune to that with care and the importance of coming together in community and supporting one another, which is after all one of the goals of why we're here today, and just bringing awareness, generating awareness, coming together in community and support of one another in our own individual journeys, but also together as a collective. So with that, I really do want to thank everyone for being here for this live broadcast of our webinar, and also those who might be listening back to the recording later on. Thank you so very much to our guest speakers today, Jenna and Jake and Kanisha, for sharing your incredibly special stories and speaking truth with us and speaking inspiration and encouragement in that, and being really real in your journey and in sharing your story. So thank you for bringing that vulnerable side, that authentic side into this conversation. And thank you to all of those who have also joined in, asking questions and just listening and taking whatever meaningful pieces of this away with you. And so we're actually, just to end here, we are actually doing a surprise giveaway. One of the lucky participants here on the call will do a selection for 3 months of free access to our Aila Health app, the premium version, which includes educational content, access to integrative care, health coaching. I know Kanisha was really speaking so strongly to that and the value of wellness coaching and life coaching. So that's available to our lucky winner. And plus there's a whole lot more that comes with this. So I will turn it over to my colleague, Sarah Joy, who's going to take a look at our participant list and choose the lucky winner.
Thank you, Shannon. And thank you all to our speakers again. Just so appreciate getting more of an inside view. Makes me so thankful for the work that we're doing at Aila Health. And I did look through our guest of participants, and I'm excited.
Drum roll, please.
I can't do one, but make it up in your mind. Kristen Parthemos. I hope I didn't butcher your name, but congratulations.
Yay, Kristen.
Oh, that's so exciting. I'm gonna cry.
We really are thankful for you joining and for your comments in the chat, and we'll follow up with you after the webinar and give you a code so that you can redeem that for your 3 months of access.
And the Aila Health. Thank you, Kristen. Yeah, we'll be in touch with you on that for sure. And the free version of the Aila Health app, well, it's free and it's available for anyone who's interested in taking a look and just adding another tool into the toolkit for managing your health and managing your symptoms and tracking symptoms, and just a way to navigate and take control over your health and in a special way. So we'll be back. This is just part one in our 3-part series. So we'll be back for part 2 on Thursday, June 10th, where we'll focus on the impact of nutrition and eating on autoimmunity. So we're going to bring in some experts who can speak to how we can leverage our nutrition so that we not only survive, but can thrive. And so hopefully you'll join us. And again, if you'd like to learn more about what we're doing here at Aila and the impact that we're making within autoimmune communities and with chronic illness communities, please feel free to download our app. It's available both for iPhone and Android. You can check us out online at ailahealth.com, and we're all over social media, all the places, Instagram, Facebook, Twitter. So I can post this in the chat. So once again, thank you so much, everyone, for being here, and I hope you enjoy the rest of your day, the rest of your week.